Victoria's Premier Daniel Andrews has delayed making announcements on the easing of coronavirus restrictions in the state. Described as a cautious pause, the Premier says he's still waiting on results of more than 1,000 tests following an outbreak in Melbourne's north that's expanded to 39 cases across 11 households. Victoria has recorded 7 new coronavirus cases and no deaths in the past 24 hours. Here's Elias Clure from Melbourne.
Well, the Premier had hinted all week that there would be significant announcements today, and many people took that to believe that there would be a significant easing of restrictions and potentially the opening up of the hospitality and retail industries. However, he said that the patient Victorians here should wait another 24 to 48 hours while they determine the true size of this northern suburbs outbreak. Now, he says health authorities are eagerly awaiting the results of 1,000 tests that are currently in the pathology lab. As well as that, they need to find or see the results of 60 critical tests that are of close contacts of coronavirus patients. Additionally, there was 2,500 tests in the northern suburbs yesterday. Jerome Weimar from the Department of Health said today that he would like to see that number again today before the government can truly, have a clear picture of how much virus is in the northern suburbs community. Now, in terms of the disappointment across Melbourne, it's pretty evident to see. I think a lot of people were hoping that these announcements would come today. In fact, the Lord Mayor of Melbourne, Sally Capp, has said she's bitterly disappointed. The former Health Minister, Jenny Mikakos, didn't hold back on Twitter this morning as well, saying that it was paralysis in decision-making from Daniel Andrews and senior ministers who have not moved to make a decision today. Of course, the threshold that the government set was to get under 5 cases. It's, of course, under that now. Of course, Daniel Andrews, after setting that threshold, made a number of different caveats, including mystery cases. But he's urging people to be cautious because the virus, of course, can take off at any moment. Let's have a listen to what he said.
We had hoped today to be able to announce that Metropolitan Melbourne would take some significant steps, not from today but from midweek, around retail, hospitality and a whole range of other important next steps. We're not in a position to do that today because we have at least 1,000 test results from that northern metropolitan outbreak that are in the labs. We will get those today, probably the balance of them tomorrow, and there will be additional testing conducted throughout the day. This is not anything other than a cautious pause.
That was the Premier Daniel Andrews there. Elias, of course, this all hangs on that cluster in northern Melbourne, the Preston area in particular, and those tests that have been taken there. What is the latest details on what's happening in northern Melbourne there?
Yeah, well, we know that 6 of the 7 cases recorded today are part of this northern suburbs cluster, which has grown to now 39 cases from just 11 households. But, of course, Daniel Andrews today said that it's possible that there's more coronavirus in these communities that the testing isn't picking up. As a result, there's now 15 testing sites across the north of Melbourne. There's a massive testing drive going on there, and they're urging anyone in that area to get tested. But as you mentioned, it's really focused in this Preston area around the East Preston Islamic Community College, where there's now 5 cases. Of course, that all started from just 1 student.
Paul Zahra, the Chief Executive of the Australian Retailers Association, says the delayed reopening is causing a new level of frustration.
We've achieved the rolling average caseload of under 5, and I think if you're asking Victorians to be patient, I think this is now really testing their patience. We have retailers that are on the brink of survival, and they were all set for a reopening this week, and that's clearly not going to happen.
So how critical is it for businesses to have certainty around what those steps forward are? How important is one day to the next?
Well, look, this is the all-important Christmas trading period. Up to 2/3 of a retailer's profits made through this Christmas trading period. So every single day counts. And of course, there's been an absolute roller coaster of expectations, delays and disappointments, I might say. So, this is really testing everybody, Victoria and the rest of Australia, I guess. And, it's having a massive impact on mental health of business. And of course, Victorians are locked up right now. So we're advocating more for a hotspot strategy, not dissimilar to the way New South Wales has handled the situation. And this lockdown has got to end.
What's your expectation of how public health safety rules will work for business when they do reopen, particularly when it comes to these issues of contact tracing? Because this is where we are today with the need to, of course, ensure that any further cases and positive cases are contained and appropriately dealt with.
Well, again, I say we prefer a hotspot approach. Those essential retailers have been trading, have been exemplary in their COVID-safe plans. I think if you look at supermarkets as a real call-out, Perspex screens, COVID-safe markers, hand sanitizer, QR codes, etc. So there are ways to manage through this. We have to obviously learn to actually live with this new COVID and this new COVID safe situation, and keeping all business shut down right now we just don't believe it's a smart move.
Where do you see retail businesses in the weeks ahead as we now look at, as you mentioned, the all-important time of Christmas? Are measures in place that will see businesses supported and economic recovery taking place across Melbourne and also Victoria more broadly?
Well, look, the road to recovery is a very long road. So the first agenda item is really to get the retailers open and trading. I think once we've done that, then we can work very closely to get a full retail recovery. And we know in the city of Melbourne, as a good example, it'll take probably about a decade to recover after this particular lockdown. So there's a lot to be done. We have had some government support, but it's clearly not going to be enough given that the lockdown's been going on now for months.
The federal government is calling for Victoria to reopen for the sake of people's mental health. Federal Health Minister Greg Hunt says the effects of the ongoing Melbourne lockdown, particularly on young people, is stark.
There are immense challenges for mental health. In the last week, we've seen the figures coming out of Victoria, a 31% increase in MBS subsidised mental health services compared with the previous year, a 77% higher rate of use of mental health services for Beyond Blue. And of deep concern, and it's a real personal cause and passion, is the fact that eating disorders for younger Victorians are up 40% year on year in terms of presentations, and that's an insidious and agonising condition. So that says that what we're facing in Victoria is a dual challenge, working our way through COVID-19, and the numbers have reduced dramatically, and I think in a way which provides deep hope, and at the same time supporting people for mental health. It says that the balance has changed. That which has been achieved has allowed us to move forward. And so what we see now in Victoria is a 14-day rolling average of under 5, well under the standard set by Victoria, well under the standard set by the Commonwealth Chief Medical Officer. And on that basis, the Commonwealth position is that Victoria should be recognised for where it is now, that it's in a position where numbers are low and with a strong testing, tracing and isolation regime. It's therefore in a position to take the next steps to opening up safely, and we hope and we commend to Victoria that the Commonwealth will support them in moving to those next levels of reduced restrictions in line with New South Wales.
And if you need information or support, you can contact Beyond Blue on 1300 22 4636. Or if you or someone you know is experiencing distress, please contact Lifeline on 131114. New South Wales has recorded 7 new cases of coronavirus in the past 24 hours. All are returned travellers in hotel quarantine. It's the third day in a row that the state has recorded no locally transmitted cases of COVID-19. There are now more than 42 million coronavirus cases globally after more than 468,000 new cases were recorded worldwide yesterday. The US has had its highest ever daily increase, while Russia recorded a near record. Lockdowns and curfews are again being imposed across Europe, with case numbers spiking again.